Hello, my name is Alyssa, and today I will be talking to you about gender career implicit bias. So what is gender career implicit bias? Gender career implicit bias is how we associate males or females to the concepts of career or family. Now, when taking the gender career bias implicit association test, it measured how quickly we associate male names like Ben, Paul, or Daniel to the concepts of career or family, and then how quickly we associated female names like Michelle, Rebecca, or Emily to the concepts of career or family. At the end of the test, the results showed that the highest percentage fell within the moderate automatic association of male with career and female with family. Now, overall, we can see that 75% falls within an automatic association of male to career and female to family. And while it may seem that our culture is moving away from strictly male in those white-collar jobs, it's still an implicit bias that many people in our society share today, and it has a huge impact on our healthcare system for not only the employees but patients as well. There are many ways that patients and providers alike can experience gender career implicit biases in healthcare. Gender career biases can be held by healthcare workers against each other. Healthcare workers can hold them against their patients, or vice versa. An example of healthcare workers holding implicit biases against each other is explained in Example 1. Heather, an experienced surgeon with extensive background research, applies for department head at her hospital. Dr. Green also applies for the position with less experience. The hospital's selection committee, who is comprised of mostly men, picked Dr. Green, subconsciously associating leadership with manly qualities like authority and assertiveness. An example of healthcare worker to patient gender career implicit bias is explained in Example 2. Emily, a 40-year-old woman, complains of frequent chest pain, exhaustion, and nausea to her male doctor. Dismissing her symptoms as stress or anxiety with the idea that women are more emotional, he prescribes her an anti-anxiety medication without further testing he may have ordered for a male patient. Later on, it is discovered that Emily was suffering from angina due to coronary heart disease. An example of patient to healthcare worker gender career implicit bias is explained in Example 3. Michelle, an elite cardiologist in her field, is seeing a new male patient, Greg. Upon her arrival, Greg explains that he thought he would be seeing a male cardiologist and requests to switch because he feels more comfortable, while unconsciously he's assuming that a male cardiologist will be more competent since gender career biases favor men in this field of study. The implications of implicit gender career biases include an unbalanced representation of women in leadership roles, leading to fewer research opportunities from the female healthcare employed population, and health disparities due to the underdiagnosis, misdiagnosis, and therapeutic treatment of female patients. Perez Sanchez, a researcher at the Neurovascular Laboratory of the Institute of Biomedicine, conducted research on the gender gap in the leadership of health institutions. She found that globally it is estimated that women represent 70% of health workers, yet only 26% of representative positions are held by women. Out of the 62,946 studied healthcare workers, 74.15% were found to be women. 58.27% of all management positions were held by men. They also found that it is 3.85 times more likely for a man to receive a management position in healthcare than a woman. The table on the left shows the percentage of men to women in specific fields of higher level study of healthcare. We can see that men hold a majority of these positions. We also know that it is more common for women to be in the traditionally female-oriented healthcare roles such as nurses or pediatrics, things like that. Balance in management and research roles is important for healthcare so that more than one perspective is being shared. It is no surprise after looking at the studies and numbers that women can often be misdiagnosed when they are so underrepresented in these important higher level roles. Another study conducted by Chiara Moretti and her colleagues at the Department of Medicine and Surgery at the University of Parma, Italy, researched how gender and sex bias play a role in the clinical treatment of women's chronic pain. They found that chronic pain primarily affects the female population, but most studies investigating pain mechanisms are mainly conducted on the male population, and most drugs are tested on the ideal male type, and even the recommended dosages refer to this standard, even though women and men have different abilities to metabolize the active ingredients. The situation mentioned before in example 3 also explains that pain management in women is often overlooked due to the stereotype that women are emotional and therefore exaggerate pain and symptoms they're experiencing. These factors lead to women being underdiagnosed or left untreated for chronic pain conditions, which ultimately increases health disparities such as increased mortality rates, increased life-threatening illnesses, and decreased overall quality of life of women suffering the consequences. To eliminate health disparities caused by gender career implicit biases, it is important for us to implement interventions in our healthcare practice. These can include self-assessment education, blind recruitment processes, incident reporting procedures, and standardized patient care. Self-assessment and education includes taking a test to identify your implicit bias, such as the Gender Career IAT mentioned earlier, and attending an educational presentation to increase awareness. A study by Katrina Hui, community psychiatrist at the University of Toronto, found that faculty who received this intervention increased the hiring of women by 2 times the amount of those who did not. Another implementation we can provide is blind recruitment, which is a practice in which gender identifiers such as names are hidden during the hiring screening process to eliminate implicit bias. By doing this, employers are selecting their employees based strictly on their qualifications without influence from outside factors. Incident reporting procedures can be implemented to help those facing gender career implicit biases have a safe space to express their concerns to someone they trust. All reports should be taken seriously and addressed in a timely manner. Offender patterns should be noted and corrective measures should be taken to ensure equality for both men and women. Standardizing patient care through using the nursing process can ensure all patients receive the same level of care regardless of gender. It ensures the same questions are asked to all patients experiencing the same symptoms, and treatment is based on their values, experiences, goals, and perspectives rather than if they are male or female. Here's a list of my references. Please let me know if you have any questions or comments about the content of this video.